Hi, and welcome back to the Kirsten's YouTube channel. If you are a reoccurring subscriber, thanks for joining back in. If you're a new subscriber, please think about hitting the subscribe button and hit that notification bell. So what I'm going to talk about today is something that I enjoy doing, and that's medical lab science, a little medical lab technologist, technician, medical lab perspective in the healthcare field. The reason why I want to speak about this because maybe there's someone that's thinking about going into this field. Maybe there's someone in the field and they just want to listen. Maybe there's someone that has no clue what we do, because I get that a lot. People think just because you wear scrubs, you're automatically a nurse. Nothing to nurses, because they have oh my God, they do a tremendous job in the hospital. I also have some family members that are nurses, and I work with nurses closely here. They have a wonderful, wonderful job. But I just want to shed a little bit of light on a healthcare field that's little unknown sometimes. So what is a medical laboratory tech? A medical laboratory professional, we help analyze a variety of biological specimens, and we help patients more from the background point of view as compared to nurses that are right on the front line. But we do work closely with nurses, physicians, and other healthcare professionals, and we help to provide data for diagnosis and the monitoring treatment of diseases. What are some specimens that we might analyze? We might analyze blood, bowel, bone marrow, breast milk, CSF, which is spinal fluid, plasma, saliva, sputum, stool, swabs. We might get a swab from the oral, the nasal, vaginal swabs, synovial fluid, urine, and there are others. Those are just a few to give you an idea. Sorry about that. I take a phone call about a specimen right there. So do we work directly with patients in a clinical setting? The big answer is no, especially if you work at a hospital. Because the phlebotomists and the lab assistants, they'll have more patient contact than you. But if they have a hard stick, they might call someone from the lab to go and stick the person. But if you work in a solo lab or a smaller lab or a government lab, some clinicians, some physician labs, yes, you might have direct patient care contact more, because you might have to go and draw the blood or collect certain specimens. As in where I work, I have to go collect the blood and also go collect different swab specimens. So I do have patient contact because of that. So here, since it's smaller, we'll have to go and collect the specimens, bring it back to the lab, enter it, analyze it, spin it down and analyze it, test it, give the information to the doctor or the provider. Examples of how we help patients, since though we aren't always on the front line and a lot of times we are behind the scenes, we still do help patients. It is still the healthcare field, and we still do help. We help to make sure that the blood is compatible if you're going to get a blood transfusion somewhere. If you're in a car wreck or something and you need blood, we will make sure that the blood is compatible and that your body won't reject it. If you're having like a liver transplant, a heart transplant, some kind of organ transplant, we also make sure that the organs are compatible so that your body doesn't reject it. That's a very big thing too. If you have cancer, we diagnose the cancer by looking under a microscope at your cells. We also can diagnose with, if someone's trying to have a kid, we can say, well, this one's infertile or is not the high sperm count, so forth and so on. So we help in that way too. So we also help to diagnose diabetes. So though we aren't front line, we do still help out a lot with patients from the back scope. Areas of the lab and classes that you might take if you decide to go into this field: molecular diagnostic, microbiology, clinical chemistry, hematology, urinalysis, body fluids, blood bank, immunology. Those are just some of the area and classes. You might ask, what is required to work as a medical laboratory technician? A 2-year degree is associates. You're usually referred to as a medical laboratory technician, MLT. MT is medical technologist, which is your 4-year degree. Or sometimes we're also called medical lab scientists when we have our bachelor's degree. The difference is with a 2-year degree, you can work in the lab. You still do the same things basically, but with a 4-year degree, you can be like a manager. You don't have to be supervised. You can have more roles and more responsibilities. And of course, the pay will be different. If you go to college, please make sure that your college is accredited by the NACLs, make sure it's NACLs accredited. That's a big thing. You don't want to take all these classes and go through college and find out that it's not accredited. Because if it's not accredited, you won't be able to sit for your license. After you finish college, you want to make sure that you go and get your certification through an accrediting body. It might be ASAP, which is American Society for Clinical Pathology, or it might be through AMT, which is the American Medical Technologist. You might want to be wondering, are the classes challenging? Yes, the classes were challenging. You have to study, you have to put in the time, you have to put in the work. It's not something you can just fly by. Where do medical laboratory technician and scientists and different one of us work? Majority of us work in the hospital setting, but you also can work in a clinic, forensic science lab, public health laboratories, pharmaceutical industries, some biochemical companies, veterinarian clinics, research clinics, and myself, I work at a psychiatric state facility. So that is also an option. That's not something I never thought about until my professor gave me a call and told me. So look around, because we are needed in a lot of places, and places that you might never even have thought about. You might wonder, is this a stressful job? It is rewarding, I must say that. But yes, sometimes it can be stressful. If you have a blood bank antigen you have to work up, that can take you hours sometimes. If the machine goes down, you have to fix it. Like sometimes you have to be the engineer and do it yourself. And everything is not always cut and dry, so you have to think. Like everything is not always just right how it is in the book. Sometimes you have to stop and think, well, why would it be this way? What would have caused it? What can I do differently? So it does take some critical thinking, but like I said, it is rewarding and I love it. Job security. Oh man, it is a wonderful job security, because it is the healthcare field, and just as sure as you are born, you're going to have some kind of healthcare at some point. So because it is in the healthcare field, and because not many people even know we exist and we know we do, so that's another reason. And there is opportunity for growth. You might start as an MLT, might become an MLS. You could be entry, you could be level 1, level 2, level 3. You might become a lead, you might become a supervisor, a manager, a coordinator, and etc. So there is room for growth, and there is even room if you want to go out and do something else, like go to med school or something. This would still be a good foundation and give you a big jump on that. So should you be one? If you enjoy science, if you enjoy working, even if you work in a lab, like independently thinking, I think more of us are introverted, though there are extroverts too, so don't comment and say, no, you gotta be introvert. But I do feel if you want to help, and if you don't mind being more behind the scenes, and know you're helping and have that reward, but not have to have recognition, I do think this would be for you. It's something, give it a shot and give it a try. I love it personally, but you have to find what works for you. Thanks for watching my video. If you do go to take the ASAP, please check out my other video, because I give you tips and hints on how to pass the exam. And thanks again. Bye.